What's going on, everybody? Very excited to be with Dr. Eric Block. I've been practicing dentistry for, he can say the 20 plus, because I think it's been more than 20 years practicing dentists. But more importantly, Eric has done so much even outside of his practice, educating people in the industry and all kinds of things. But wanted to spend some time with him today, just getting his feedback as a clinician on the Infinix product, some special use cases where he sees that it is beneficial both now and in the future, as well as how he sees it and compare it to some other things on the market. So Eric, how you doing?
I'm doing great. Yeah, thanks for having me. And yeah, I finished BU in 2004. So I'm in July 2004 is when I started practicing. So been out for 20 plus.
Well, and I think what's exciting about today's conversation is I think I was thinking through all of the different things that you have seen in dentistry, whether it be technology or even technology in this instance, right? In the material space, something that I know, the day-to-day to dental practice, a lot of people may not recognize there are so many of these newer technologies out there, but Infinix is definitely something that has been very unique. It's been getting the attention of a lot of dentists. So love to just, give your thoughts, maybe some specific use cases of what you like about it. And then more importantly, for other dentists that are watching this, kind of your insight on it.
Yeah, well, first, I just want to touch back to what you said about new technology, and I'm all about adding new treatments, technology, and techniques because it keeps things fresh. It keeps me re-energized to go to the office, and it could be something big like getting a milling machine or a 3D printer to something small like a new composite technique. So, and anywhere in between. So if you're just doing the same old thing every day over and over, you're going to get stale, and you could burn out. So I love adding new things. And I've recently started using the Infinix product. And John, by no means do I declare that I am an expert. I'm just a regular dentist, a regular dude in the trenches practicing full time. And I want to, have the best materials for my patients. And I want to get a little bit into later on some reasons why I'm excited about the product, and then also for marketing purposes as well.
All right. So you and I were talking kind of before we came on here, specific use cases. So, you learned about the product, understood kind of what it was for. And then, I'm always intrigued, right? Practicing dentist, like you mentioned, learns of these new technologies. And then it's kind of the wheel spinning in your head, which is you look at your current practice, you look at your current patient base. And I know it's a situation of you saying, okay, like, where am I going to use this and who am I going to use this for? So initial blush, like, where have you seen the application for this, and I think where you're most excited about using it?
Yeah, I had always heard about different techniques for patients with buccal caries or cervical caries or deep caries into root, and seeing different products out there with different applications of like glass ionomer or people using amalgam because they feel it's the only thing that's going to hold up against someone with a recurrent caries rate. But I never got into those, mainly because they require different application dispensers and different ways of dispensing the material. I just wanted a regular composite that is either a packable or a flowable. So that's really what caught my eye with the Infinix is it looks just like a regular composite with a flowable, bulk flow, and a packable material. And I wanted something for my patients that have a high caries rate, like for example, your cervical filling. I was constantly seeing these patients come back in a year or two, and a lot of these are patients that are getting older. They're on more medications. They're getting dry mouth. They're higher risk for caries, and I would have to redo their fillings, and there would be stain around the fillings and recurrent caries. So I was looking for something for that type of situation.
Yeah, it's interesting. You practice for a certain amount of years, like you mentioned, you build a great patient base, they come back, and you get to look at stage one, stage two, stage three things that you've helped them with. And then along the way, I think about like what you mentioned, the parallels of like as that's going on and you're growing your practice, serving your patients, these new technologies come out. So pretty exciting, like you mentioned, that you've been able to kind of utilize this. So what about for dentists that are out there watching, what have the results been? I mean, I know it's kind of early in the stages here, but at least kind of what you are most excited about as you start to, identify these patients and where you think you can utilize this best.
Yeah, I'm excited for the antibacterial properties of it, and again, the handling of it. I don't have any long-term results to share yet, but I've used it on many cases. The handling is good, and I love it for these cases with the potential recurrent caries. And I'm really looking forward to seeing how these hold up. Personally, my practice, we're a family practice. We see kids from 3 years old, and we have patients in their 90s. And a lot of patients stayed with us. We went fully out of network, and a lot of our patients that stayed with us are in the are older, maybe retired, and I start to see it. Some of them they're on more and more medications. They're dry mouth. Some of them, even their dexterity isn't there, and they're more susceptible to recurrent decay around restorations, especially composite fillings. So that's where we're really excited to see if this can really hold up for those patients.
It's interesting, Eric. There's been a lot of excitement when talking to practicing dentists and their teams about some of the newer technologies around AI. When we talk about a material like this, right, it doesn't carry the same buzz as would be, AI. But it's interesting to have you share that patients are needing this. And one of the things I wanted to ask you is, are you finding that patients uh, are more open to want to learning about some of the newer technologies out there? And of course, this is a little bit of a different example than one would typically, talk about in this case. But I do think it's interesting that you mentioned, like, you have this patient base, you have this trust. Are you finding now that patients are asking questions, like if you bring something to their attention of what something might be going on in their mouth, that they're open to that, right? It's almost like they're excited to kind of want to learn a little bit more about their oral health and the newer technologies and how something like this can help them.
That's a great question, and I think the key word that you said there was trust. My patients are there because they trust me, and most times, typical patient won't ask, except for like your chemist, your scientist, your engineer. They really like to get into the weeds and talk about, I can geek out on some of the materials and technology. Most patients don't ask unless I bring it up. And that's something I'm starting to do more and more is really show off what we have in the office. I want my patients to be wowed so they feel like, not only do they trust me, but now they've gone out of network and I want them to tell their friends and family about me. So I want to wow them. I want to tell them they're in the best hands and I am using the most state-of-the-art materials, most state-of-the-art technology. And that's a great way to really grow a practice. So if I get into it, some patients just don't care and some patients love it. And then there's the people in the middle. Whereas if I bring it up, some people are like, "Wow, that's really cool. Thanks for sharing that." I think it can really go a long way to really help you grow a practice and show off what you're using in your practice.
It's such an interesting perspective because it seems like common sense, right? Which is to, establish that trust with the patients. But it does just feel, and that's the reason why I wanted to ask it. It does feel like little by little, even since the pandemic, that more and more patients are taking, hopefully, more interest in their oral health. There's more and more out there in regards to the oral systemic link. And so I would imagine knowing and understanding what you're going to do to help them, whether it be for some of these older restorations, and more importantly, the materials that you're going to use, goes a long way. And like you mentioned, like it might seem a little over their head in regards to the science behind it, but if I know anybody in my family, I actually recently took my daughter in, and she's 9, and she's very inquisitive, and she was asking every question in the book, like, "What are you doing? What's going in there?" And so it is interesting. I do feel like that's going to be more and more something that people want to know along the way, and I hopefully it solidifies the work that companies are doing with this, this product like Infinix, to be able to kind of, put that science behind it to then hopefully instill that trust that you've already built with your patients, but more importantly, in the materials that you're offering to help them with their oral health.
Yeah, actually, John, you mentioned, um, did you say your 9-year-old, was it
Yeah.
your niece?
My
Your
daughter.
daughter.
Yeah, yeah,
Okay.
yeah,
Yeah.
yeah, yeah.
So I actually want to talk to everyone like they're a 9-year-old, like my son is 9 as well. I want to talk to them in lay terms so that they understand. And yes, there's going to be that small percentage that is, a scientist or engineer and they want to really go into it. But I want to tell patients, look, Judy, you have an enormous filling. This on a tooth that you've had since you were 6 years old. It's starting to crack. It's time for us to clean it out. I have an antibacterial, antimicrobial material I can put in there after I clean out your old filling, and we'll put a crown on this tooth and cap it. I really feel like not only do they trust me, but they can understand what I'm saying. And a patient that understands is more likely to move forward with treatment than someone that doesn't understand.
Yeah. Yeah, so good. And then last, Eric, I'm familiar with the supply closet or closet in a in a dentist practice where over the years you go to a trade show, you work with a company, you get excited about a product, you bring it into the practice. Sometimes you use it, sometimes you don't, sometimes you try it out. Uh, for any of the dentists that are out there watching, any final words, just as, for anybody that's on the fence, kind of interested in this Infinix, but, just from your perspective as a practicing dentist of, why should they, at the very least, try it, learn about it, and build it into their practice.
Yeah, it really doesn't change behavior. You don't have to get like a special dispenser or fancy tip or get a whole, like a special cartridge for it. It just looks like your normal composite, flowable and a bulk flow, which is pretty much the majority of what I'm using. And then they have a packable, which you can use for anterior cases, or if you like to use that for like your cervical composites, I love it for that. And then also, I often feel like, and I'm going to get more into this too, but as dentists, we really want to market our milling machine, our intraoral scanners, our 3D printers, our AI, and all these big fancy things. But you can also market something like this, on social media or put it up on your website. We're
Yeah.
using an state-of-the-art composite material, white filling material, and let patients know what you're using and get some new patients out of it. So you can not just market, the really expensive stuff that you have, but your everyday composite material like Infinix.
Yeah. I love that, Eric. It's such a great perspective. And again, like we said, as patients are more interested, especially with newer materials, when you make a suggestion of what you're going to do in an effort to strengthen their teeth. So, well, thanks a lot. I know the Infinix team really appreciates you taking the time to give your feedback. And as always, it's always great to talk to a practicing dentist and just get real life feedback from actually using it in your practice. So appreciate your time.
Thank you.